Hello, it is September 28th, 2021, and we're here today with Devi Sridhar. And I am going to just immediately turn this over to her to talk about kind of introduce herself to all of you, although many of you may know her, and to tell you about what she has been doing the last 20 months as part of the pandemic response. So Devi, over to you, and thank you so much for doing this.
Well, I'm delighted to do it and always happy to see you, Rebecca. So I am a professor at the University of Edinburgh, was generally working on governance and financing and global health and low and middle income countries, which focuses on infectious diseases. So I had a team of researchers looking at infectious disease management, for example, malaria in Senegal, cholera in Haiti, childhood pneumonia, which is linked to infectious diseases in India. And alongside had done some work looking at previous outbreaks like Ebola and Zika. So I was, running my research team funded by Wellcome Trust, largely focused on, again, low and middle income countries. And in December 2019, I had done an interview actually for the University of Edinburgh kind of magazine. And they asked me, what do you think is the big issue for the next year? And I said, I think it's pandemics, and the next pandemic is around the corner, though I actually thought it would be related to antibiotic resistance. So I was thinking there'd be some kind of problem where we see a new strain of bacteria that would make operations more risky, and this would spread quickly, and we would end up in a more kind of situation where medical care. I didn't anticipate it would be.
Not to worry, that will be the next one. So
so January emerged. I think we all saw the reports in early January 2020 about this kind of cluster of pneumonia-like cases in Wuhan. And I guess Rebecca and I were chatting, I think others, like, what is this? Is it SARS? Is it MERS? Is it a new influenza? But I don't think anyone knew yet it would be a pandemic, because a lot of these things happen quite frequently. So you're often hearing about things like, Nipah virus in India and Kerala, or plague in Madagascar, or yellow fever in Brazil, or Lassa fever in Nigeria. So you're kind of used to hearing this, and very few of those events become pandemic events. They usually are localized or regional events, still catastrophic for that area, but not globally in the same way COVID has been. And then I think it became clear by mid-January, when Wuhan went into lockdown, that this was not the flu, that there was something much more serious going on. The Chinese government was very limited in what they were sharing, and there were daily WHO briefings, which we were following, which was giving us the latest information. And it all kind of started unfolding in real time, and we were just racing to understand this. But I think for me, kind of the light bulb kind of went on January 16th, that this is going to go badly. And then it kind of just got worse and worse and worse. And every path where it could have taken a good path or a bad path, it kind of took the bad path. It was mostly doing media. Our research team then switched over to work on COVID, to track South Korea, track Taiwan, track China, their management. And we were really worried actually about African countries and poor countries. So I think listening to the WHO make the emergency declaration end of January, again, no one was really looking at Europe or the States. Everyone was looking at, like, what does this mean for Haiti? What does it mean for Senegal? What does it mean for South Africa? Because that's what the context you could just imagine spread would be limited. I think no one really expected, at least in my view, the US and UK to be hit so hard, because the idea is we were so prepared in the preparedness index. So doing a lot of media at that point, basically translating to the British public, some on CNN, to the American public, what is happening in China, and trying to explain it. And it wasn't really involved. People used to ask me, is everything okay in the UK? And I'd be like, all's fine, because all seemed fine, until mid-March, when the UK decided to go towards what we call a herd immunity strategy, which was everyone was going to get it. And they said they were following the science. And I was not on any of those expert groups at the time. No one knew who was on the expert groups, because it was not transparent. But there was a confusion. And I remember colleagues from the States and from Germany calling me, and it's like, what is Britain doing? Because everyone was trying to learn from each other, and no one could understand. Like, there was East Asia doing a certain thing, and there was, test and trace, and there was infectious disease protocols. And they're like, Britain was just going its own way. And funnily enough, Sweden and the Netherlands were watching the UK. People look as if it was Sweden, but it was actually UK, which went that way first and then pivoted. And so I started getting more involved in British media. So on March 15th, a few days later, so I reflected on it overnight, and I was like, what are they doing? It doesn't make any sense to me just to say, carry on, because we knew the hospitalization rate was coming out of Wuhan. At least, they were saying 20% of patients needed hospitalization, a third of them ICU. So you just don't have to be a mathematician to work the numbers to be like, letting this go. we had seen the images out of Lombardy in Italy, so close to us here. We'd heard the ICU doctors' reports, and it just seemed, so I started speaking out alongside, I would just say a few others, very few others, saying there's something off with this strategy and we don't fully, why are we doing this? And so I wrote a piece March 16th called Britain's Gamble in the Guardian Sunday column, which was like, East Asia is going this way, Hong Kong is doing this, Singapore is doing this, South Korea is doing this, and we are going here, and trying to explain to the British public, what are they trying to do, which was have the virus run through the healthy, shield the vulnerable, and then hope by the time it had run through, the vulnerable could return, and we'd go back to some kind of immunity to all of us having some protection from this through the herd. Yeah, and obviously it didn't go that way. So we went into lockdown 2 weeks later, and at that point, my role became very public and explaining what was happening to the public on often several times a week, appearing on morning TV, Good Morning Britain, BBC Breakfast, Channel 4 News, BBC News. And it was really, for me, like just taking a time when people were really confused, really anxious, and just being like, this is what's happening. This is where we need to go, and trying to I just kept pointing to East Asia to say, at least with this virus, there's another way we can try to manage it. Because the trick for me was, it was how to suppress without going into locking everyone in their homes. And so that was, I think, the trick of COVID, which was how do you buy time for a vaccine or some kind of breakthrough? Because we knew there were so many vaccine trials taking place. And it seemed like, I remember I was on this show Question Time in March, and I was debating someone in the business sector who was like, lockdowns are delaying the problem. We're all going to get it. So why are we taking the harms of lockdown? And so I said to him, well, because science might come along and we might have a solution of some kind. And he's like, there's not going to be a solution. There's never been a COVID vaccine. And I was like, yeah, but there's like dozens of trials taking place. There's therapeutic trials that were getting started here, even at Edinburgh University, of what could save people. I was like, buying time makes sense. And he said, well, look at HIV. We don't have a vaccine, so we could go for decades. And I was like, yeah, but we have antiretrovirals, which means people could have survived if they had lived till the point there were antiretrovirals. And there could be something like an antiviral against COVID. There could be a vaccine, even partially effective. Like, we have to give science time. And I think that was the kind of the message I was trying to give to people, which is like, science will ride to the rescue. We don't know in what form. It could have been easier testing, which we got to. It could have been antibody testing. It could have been better understanding of genetic risk. So we can screen people to understand who's at severe risk to develop complications. But it seemed to me there was such uncertainty that you wanted to just kind of press pause and wait and see. I was running my research team at the same time, producing evidence, and then joining expert groups like the Wellcome Trust, Royal Society. And then I joined the Scottish Government Advisory Group as well, which started providing advice directly to Scottish Government about schools reopening, about opening nighttime curfews. I mean, the same issues every place had: alcohol in pubs, distancing, ventilation. And we were meeting 2 to 3 times a week for several hours. I've probably spent now we've been at like, I think 110, 120 meetings. And just, it was pretty rough, I would say, just real burnout of just trying to get on top of this and feeling like you were behind of this. And yeah, so that's been my role. So running my research team, trying to directly advise government in the best way we can. And it became just harder because I remember Alpha came into the picture and that changed everything. So we were sitting in meetings on Christmas Eve because we could see the reports early December out of south of England. We weren't hit yet, but we knew it was coming. So you could see, and we're like, the modeling was horrific in terms of what it would mean. Then we could see Delta out of India, and then it kind of sweep through. And so at each point, it's not like it ever ends. It's like the problem changes. Doing the public sides, you're constantly communicating, which I took very seriously because I think people want to have good information, and there's too much information. So they want trusted sources of like, say it to us really simply. And I think a lot of the scientific threads I see on Twitter are very complicated and people just can't follow. So it was just being really simple. So like a message before Christmas that I was giving out was like, don't meet over Christmas, wait 3 months, the vaccines will be here in January, and then have your Christmas in March. And that was just a simple message people could get. Or, and I got in trouble for this one saying like COVID spreads like smoke because people are arranging their Christmas tables 2 meters apart, but all in the same room. And I was like, if someone's smoking 2 meters away from you, you're going to smell it. I mean, COVID doesn't spread as far, but people didn't understand how it spread. So using analogies they can grasp. Yeah. And so that's what I've been doing. And also just finished my book, which has gone to press, which is coming out in May. which is takes up the question of why, when faced with a common challenge, governments did such different things. And it kind of spins from around the globe. One chapter compares Sweden versus New Zealand, being like, why would two countries, both advanced, both having smart scientific advisors, see a similar problem and address it so differently? And then kind of gets to where we are today. Who knows where it goes next? About, the vaccines and boosters, and it kind of ends there with vaccines and what it means going forward. So yeah, so that's a nutshell.
Just that, so it's you've had a very quiet 20 months and lots of long walks and so going into all of this, I think one of the things that's interesting for me to hear is that we knew our community before, right? Like we had a relatively small community of colleagues, and some have been very, like yourself, have been very kind of on the front lines and very public and doing a lot of media. I will tell you, I never had a moment of media training. And, I think some of this is like, we teach this, so we sometimes know how to communicate, but did anything prepare you for kind of being thrown into the spotlight? And, can you walk down the street now in Edinburgh and are you recognized? Are you like, what is that? How has your life changed?
No, I had no media training of this level, and I'd never done anything of this scale. Because as you know, in the past, I would do media, but it was like on WHO reform or on the new Director General of WHO, which was so niche and not very controversial. And people generally are like, wow, that's so interesting. Where all of a sudden you do COVID and people just want to throw eggs at you all the time because there's so much also misinformation. And I mean, the anti-vax community, I mean, they're militant. I mean, I smile about it, but they're like, I don't really know what motivates them. That's what I find strange, because here, at least in Britain, it's never been mandatory vaccination. It's optional. It's a choice, right? So people who want to get it and people who don't, but they get very angry about that choice. So I'm like, if you're all for freedom, you should say people should choose, but you can't really rationalize. I mean, it's like, how do you, and the people in the States, but here as well, there are people who are in ICU who still think COVID is a hoax. And the doctor's saying that this is a real thing and they don't understand what's happening to them. And so, yeah, I think what's been the hardest thing is the public side. And I went into it because I really went into it. I liked explaining things to people about what was happening. So I thought maybe it could help, but also because I really thought the UK was off track. Like I really thought we're going to kill people with this approach, because the idea, which gained a lot of traction, and I know it's also gained traction in Florida and the States, was like, we're just going to shield the vulnerable and let it run through. And if you've worked in public health or in public health systems and you understand society, that's impossible, which has been shown. Even with vaccination, it's very difficult to kind of shield people fully from an infectious disease that is this transmissible. And so I think like it was almost kind of trying to steer things to say, yeah, it would be great if it was like a model and we could put all those people. We don't live in models. We live in the real world, which is more messy, more complex. Look at who works in care homes. Who are they going home to? Multi-generational families, people who live in crowded housing, public transport. I mean, it's not like everyone lives in like a country mansion and can sit there for 18 months having their deliveries, coming from people who drive them, right? So I think I got into that for that. And I think what's find hard is like people attributing motivations to you that are not there. So people saying you're a pharma shill. I've got no money from pharma at all at any point. And in fact, Pfizer and GSK and J&J, Merck, they've asked me to come onto their advisory boards. And I've always said no, because I'm like, if I do that, even if it's unpaid, even if it's scientific, the association will be like, there's people to see me as pharma. So I've stayed away from pharma, but I'm pro-vaccine because I'm like, I don't want people to die. The anti-lockdowners and my view of them, I'm like, I'm not I'm not pro-lockdown, I'm anti-death. I'm like, what is your solution? And so I think they're coming back and saying, well, you can shout about being anti-lockdown, but unless you're willing to create a vaccine, build a diagnostic, or pull up and go work as a cleaner or a staff in a hospital to help the hospitals, what is your solution? Because the hospitals are going to collapse. So I think that's been hard. I think it's the backlash of like people attributing motivations to you, or a post that got shared thousands of times that I'm like part of the deep state and this is a conspiracy to kind of like infiltrate government and kind of take over. And it gets shared thousands and thousands of times. And people are like, Chatham House, Harvard, Clinton, WEF, and like not realizing that obviously in the course of your career, of course you're going to encounter, I've also worked with Save the Children and Oxfam and I run. Does that connect as well into the conspiracy? But like, I think the misinformation, I think, has been the hardest thing, because you can't really fight it with facts because it's completely irrational. People just believe what they want to believe. It's like insane. It is insane, but people believe it. So you can't really, I think Dr. Fauci said this, but I think back to kind of like, how would we have ever eliminated polio or smallpox or even things like measles if nobody would believe anything from the public health officials because they were being told it's a hoax, or this is, there's no, yeah, there is something peculiar coming out of the media on these things. I don't know. And it's uncontrollable.
Yeah, I don't even have a response to that, just because I think we all feel similarly. Debbie, tell me, what does the next couple months look like for you? Hopefully there'll be a little bit of running around and talking about your book and promoting it. But like, are you teaching? Are you still advising? Like, what's the next 6 months look like for you?
So I'm still advising. So after this, I'm going to go on to an advisory group, which is on universities and higher education in Scotland. I'm also on the children's and schools group. I mean, these are ongoing issues. I mean, hospitals, we're still in the midst of a pandemic, but people may not think that. I'm on the main advisory group, doing a lot of things like this. So, panels, expert briefings, and actually, I really enjoy the global advisory groups with people from other countries as well. So I was on the Chief Minister of Kerala pulled together a group of international advisors, and it was fascinating because I heard someone from Melbourne, I heard someone from Seoul, I heard someone from Hong Kong, and that's your checking in, like, because when you're too much in your own bubble, you don't see what else is happening. And we're all dealing with the same issue. I think that's what's been lost in this, is we're all dealing with the same virus. We're all similarly have, different resources, but we're all human. So how do we start to address them and try to kind of get ahead of this? Research. So running my team still, I've got an extension with my grant, but I got to put in more grants. So back to normal life. And I do a bit of media, but it's much more kind of focused, I would say. As the pandemic went on, I was getting like 40 or 50 media requests a day, and I just couldn't keep up. So now if I know the journalist, or I think it's an important topic, or I feel like something needs to be said on it, I will kind of emerge and kind of engage. But otherwise, I kind of just leave it, because I'm like, there's enough people out there doing it. I don't really need to. I kind of want to fade into the background. I feel like I need to fade in the background. The other thing I've been working on of interest to the States is there was a National Academies Commission, Peter Sands chaired, and I was a co-chair, vice chair of it, which looked at kind of influenza preparedness for the next. And I found that fascinating, of like just thinking ahead 5 to 10 years of kind of what are the lessons. And so that's been the other thing, kind of now looking ahead to the next frontier of what's coming. I'm teaching a bit, PhD students, and I'll teach on a couple lectures here. But yeah, that's kind of my life. And also just kind of trying to kind of just, I think all of us could just like deal with the burnout as well, of just, and it's not even physical burnout, it's just the emotional toll of people seem to blame people in public health for the crisis, and always. So we're blamed for lockdowns, we're blamed for restrictions, but we're also blamed for the COVID death toll. Like, oh, if you were good at your job, why did 100,000 people die? If you were good at your job, why do schools have COVID infections? If you were good at your job, why? And you're like, we're trying our best. Like, even now with schools, you can do what you can, but in the end, you can't stop teens from being teens. Like, we're also living in a Western society as well, which means you can't put in some of the measures that have been used by other countries to stop infections. So, for example, here we've been very keen with kids that they continue to play together outdoors. So there's no distancing outdoors between kids, because if the psychologists were saying that's important for childhood development, and that outdoor transmission is minimal. So what's the point of having kids in their boxes if in the end, it's not doing much to stop transmission? You should be kind of putting in your restrictions where you actually have the biggest bang for your buck: nightclubs, bars, indoor crowded settings, not kids playing outside at a play park, right? Like, but then again, some of these kids get infected and people are like, that's so irresponsible. And you're like, well, we have to weigh up the harms. It's not a simple thing. So yeah, I think I also just have a lot of reflection to do. And it's kind of also why the book for me was a bit therapeutic, because it changed from a very academic approach, which was like, typical academic book, very distanced, not much personal voice, to being a lot of personal voice, because it's kind of like, what has been the experience like, and bringing people into the room on schools. When we were sitting there in March, we just closed schools, and things, can we open them in 2 weeks? And you're hearing about this, I don't know what it's called in the States, but the PIMS condition, the pediatric inflammatory multisystem syndrome condition. And you're like, okay, is this 1 in 50 kids? Is it 1 in a million kids? Is it 1 in, we don't know. All you're hearing is pediatricians saying, we're getting these reports. And of course, you're not testing children in general. You get there, and so you don't know the community prevalence. And then people are saying, well, should we shut schools? Should we not shut schools? And you're thinking, imagine we open schools and we have a bunch of kids ending up in ICU. Like, that's the uncertainty we had. And we couldn't look to other countries. I remember contacting South Korean pediatricians, and they're like, we haven't seen it, but we haven't had your prevalence, because their cases were here and ours were like, it was seeded. So, and then New York was having this emerging. Remember, New York City was reporting this. Lombardy was reporting this. The places that were hardest hit were reporting it. And so now people say to me, well, you were for school closures in March, but you're against them now. And I'm like, because we have different data now. And now we know children are relatively unaffected, and there's ways we can keep schools open that are safer. At the point, like, we had pediatricians telling us they're having kids coming in that are severely ill, and we don't fully understand it or not. And we don't have a data set to point to. So of course you have to be at that point, risk averse. So I try to explain that a bit so that people understand that nobody had a crystal ball. And we had to move as the data moved. And I think my disappointment and some academic colleagues is those who haven't moved as data moved. The ones, like, I think of, not to name names, but there's someone who's very esteemed at Stanford who came out saying the US will have a death toll of 20,000, and was, I think, what is the US death toll? 670,000 now, 680,000. I mean, it's way off. And I would have had so much more respect for this person if they had been like, well, I thought this and this, but I was wrong. New data emerged. I'm moving. Instead of like sticking into it. No, I was right. No, I was right. No, I was right. And that's what grates me, because you got to move as the data moves, and you've got to change your strategy as you have new tools. So we have to live with this differently with the vaccine and treatments than we had without a vaccine and treatments. We have different tools now. So of course you evolve, but academics, for some reason, some have been very sticky about evolving, because they want to say, I was right from day one. And I was like, nobody was right from day one. We didn't have enough data to be right from day one. Everyone has had to move and emerge as the data came in. And that's good science. It's saying, this is what we knew in March 2020. This is what we knew in March 2021. And let's see what we learn in March 2022. And then instead of this whole thing of, I was right, and everyone wants to prove that they're right. I'm like, don't keep proving you're right. That's not the point. The point is to get this right for society, right? And not to get it right for yourself. So.
Yeah, well, it's the ultimate in decision-making under uncertainty, right? Like that's any emerging infectious disease. And I just want to thank you for everything that you've done, for bringing in the science, for bringing in the rational decision making, for helping some of our decision makers make some of these hard decisions over and over and over again, and for being able to communicate so eloquently to the public. It's been a joy for me to watch you in action. So thank you for everything that you've done.
No, and saying back to you, Rebecca, I think, in the end, I just tried to make things as simple as possible. And I think that I've often been told, like, oh, you talk about things too simply. And I'm like, in the end, we have to make things basic, because that's what people have bandwidth for. Even for me now on, like, when I see a long thread on Twitter of 30, I'm like, what are they trying to say? And I think everything,
go for a walk, go outside, get some exercise, and yeah.
And I think
those are my favorites of your tweets.
Get outside. Yep. Okay, good.
Debbie, thank you so much. And really, again, thank you so much for everything you've done.